Good afternoon all. Thank you to conference organisers for inviting me. Thank you to delegates for staying around for the afternoon, and I hope the next short session is some interest and value. I'm really delighted to be here and sharing and learning a lot from colleagues across Europe and further afield. So Age-Friendly Ireland, I'm going to be talking a little bit about the Age-Friendly Cities and Communities model, which we're supporting in extending across Ireland. I'll be looking across to the clock. I don't want to eat into Kevin's time too much. Age-Friendly Ireland it sounds like quite a clinical term. It's a small intermediary organisation, and we would support local government in taking the lead in bringing the various actors together at a local level to effect change and to build better, more age-friendly communities for all. Our vision is that Ireland becomes, I'll emphasise this, a great place to grow up and a great place to grow old, and I'll come back to that notion. So in doing so, we follow the WHO 8-domain, 8-petal age-friendly cities and communities framework model to bring about that vision. So I might start at the end and maybe just a few kind of takeaway messages that I was hoping to emphasise, or particularly if time gets the better of me, takeaway messages that I'd like to emphasise and maybe to draw out of this little piece. The first being local, and I'll probably be talking about local quite a bit. Local may not be everything, but it counts for a whole heck of a lot. The idea of the old adage of where we live impacts on so much on how we live. So it's so important to bring local actors together to effect change locally, particularly agencies working together with the community and to identify what actions need to be taken. This idea of voice, and particularly the role of listening to the voice, in this case the voice of the older person, to surface up the issues that really matter. Listening to that voice and that exercise of listening can be so valuable and so important in helping to prioritise what of course are scarce resources, and looking to allocate resources to areas that really matter. But also by working collaboratively and listening to that voice and partnering with older people, that older people can co-design the solutions and the responses that will really bring about the change that matter. That idea of lots of factors, lots of players, I think it's a theme that's run across the 2 or 3 days so far. The fact that social, economic and environmental factors are interconnected. It's rare that we look at it solely as a housing solution or transport solution or an information solution. It could be often indeed naive to do so, that we have to consider these in a holistic, interconnected way. And the idea of partnering, it's not to say that we've got that cracked at all, but we've got to get... We try and support partnerships and develop better networks, but partnership is key, and we've got to work on developing those partnerships. The whole piece could be about partnerships. It's about building relationships, developing trust, and often working at the kind of blurred lines of any one single agency's remit, because they're the areas that impact most. So it's trying to encourage and support agencies to work together and support each other in developing shared responses to shared challenges. So why ageing? And is the sole focus of the Age-Friendly programme on older people? So hopefully I'll answer the second part of that as well, or I'll come back to it. Very, very quickly, in Ireland, the population aged over 65 is set to double in a very short time frame, the next 20 years. Across that same time frame, the population aged over 80 is set to quadruple. So we can imagine there's, we understand that there's an impact on a really diverse, extensive set of areas. So the question is ageing a health issue? Well, of course it is, most certainly it is, but should health, and particularly the health services, be the only ones that are required to respond? I think all of us would say, and the previous speakers might say as well, definitely not. We have to look at our broader environment and just identify how well set up is it, how conducive is it to supporting health and well-being gains. So the argument really is, and again preaching to the converted here, but housing is certainly a health issue. Transport is a health issue. Our built environment, our streetscapes, the opportunities to participate, how safe we feel in these communities, the way an area looks, the way it feels, all these things have a big impact on our confidence, our motivation, and our ability and our facility to enjoy active, healthy, connected lives. So coming back to this idea of local, which comes first, chicken or egg? Is it policy or practice? In Ireland, probably practice has predated policy. It's wonderful that policy has is catching up. We now have a firm, courtesy of the last 2-3 years, a very firm policy direction in terms of a life course approach, Healthy Ireland framework, supporting health and wellbeing gains across the generations, supported by a sister or daughter strategies, the National Positive Ageing Strategy, the Dementia Framework and the like. But what's needed now really are effective joint local working structures to effect that change and really to lift those strategies off a page and get them out. That's our circular ring road around Dublin City, to get those off the page and out of those policy units and to make them real and felt at the local level. So the age-friendly programme approach in Ireland is built around a couple of really core principles, very simple principles, but as we know, simple can be very difficult to arrive at, very difficult to achieve, but built around this notion of collaboration. So age-friendly programme, as the previous speaker was indicating, it's the requirement, the relevance of bringing local leaders together, local decision makers with access to budget. So stakeholders from local government, from the health services, our Garda Síochána, that's our police service, relevant NGOs, the business community, education providers. So bringing them together as part of what we call an alliance, together with older people to form this alliance. So agencies working together as the alliance, and older people's joining an older people's council, which is reflective of the diverse local older population, to identify changes that need to be brought about, to go out and consult extensively locally, to surface up the issues that need to be addressed and to identify priorities. So, and together to make a plan to implement real change, yes, in creative ways, but very often in very practical ways, very pragmatic ways. And often, you know, the extraordinary lies very much in the ordinary. And in areas like better public spaces, supports to stay at home, transport that meets needs, safer places, better health services, opportunities to volunteer. So elements that make our neighbourhoods better places for all and people of all ages. So speaking to that thesis of when we design for age, we design for all, hopefully. So certainly looking to the current cohort of older people, looking to surface up that voice and identify those priorities, but together co-designing with the community members to identify solutions that will have a positive impact on all. So if we're talking about the voice of the older person, what are older people telling us? They're telling us a lot of very practical pieces. Trying to think just solely of the conference here, and the focus of the conference, I just concentrated on housing and built environment and just picking up a couple of aspects. Older people tell us the very ordinary, they want to stay living in their own home, in accommodation that suits, and where they feel safe. We've looked to surface up the voice of the older person primarily through qualitative methods, but as our previous speakers identified, we need evidence to support that, to augment that. So we have, very pleased to say, a longitudinal study on ageing in Ireland. It's into its fourth wave. It has been wonderful. It provided us with wonderful insights, but probably most pleasingly, it's been augmented in the last year or two by local study and the introduction of baseline studies and profiles on all of our local authority areas in terms of ageing and the older demographic. So just picking out two really brief slides relevant to built environment and housing. The practical things matter. Disappointingly, our older population tell us they're probably most disappointed or most concerned about those very practical things like access to public toilets and seating and appropriate traffic calming measures. Pleasingly, on the positive side, Voice told us 4 and 5 and 6 years ago that the timing of traffic lights was a big concern for older people, that they didn't have the confidence to cross the street given the time available. So we worked with local government a lot on that, and the satisfaction rating has gone up. But these are the things, like if we're talking about supporting older people to engage in their community, mindful that older people are the lifeblood of many of these communities, we need to provide them with the confidence to engage with these communities. So these are some of the practical things that matter. In respect of housing, some interesting insights, just one single question. We asked older people if they were if their home was no longer suitable for them, how might they feel about a range of possibilities? Interestingly, the least favoured option, and perhaps was the idea of moving to a nursing home, the least favoured option was the idea of moving in with a relative. So I checked that with my own mother, and she confirmed, yes, Hugh, I do love you, but I do not want to move in with you again. So the idea of, so much more favourable was the idea of moving into an adapted house, but ideally adapting one's own house to support independent living and having that house adapt around one's changing circumstances. So as we all know, these issues, this range of issues are taking place with an increasingly complex set of circumstances. This picture from Brazil, I suppose that juxtaposition between the favela up against the five-star resort, I think it really sets it out. It's probably not as... I think we can all identify with that, even though that is quite dramatic, but it's taking place within this context of demographic change, aging populations, migration, a global economy, climate change, and looking to build sustainable, age-friendly, supportive communities, and looking to build communities that work for us as we age. So I think this is a concept that, going back to one of our very, very early speakers, spoke from the Innovation Centre in the Mayo Clinic about pushing left. Traditionally, in the kind of hospital healthcare settings, we would have talked about the requirement for service quality, for equitable access, all within a financially responsible environment. But we're looking to, I suppose, to push out, to push to the centre, and to involve whatever the client, the patient, but ideally the person, and encouraging this idea of empowerment and promoting responsibility amongst the community. So again, like our previous speaker, I think we're definitely playing catch up on this front, trying to capture this practice. I suppose the investment over the last 4 and 5 years has been trying to develop this infrastructure to support this collaborative planning across agencies working with older people's councils. But practice has been happening, and often very much on the focus has been on the practical and the pragmatic. A number of documents that for those interested could be able to pick up over the coming weeks on our website. I might just pick up on one of those on housing for older people and share with you some of the key findings. This research was made possible by with the generous support of the European Commission. We looked at a number of good practice examples in Ireland, the UK, and further afield across Europe, and it really spelt out, apologies in advance, the very obvious, but it has proved to be very valuable for us in, I suppose, promoting these messages and having these recommendations picked up by policymakers. So obviously the need to, as what is it spelled out, the need to combine certainly the physical and the design related considerations with the technological and social considerations. So as we said, we looked at a number of good practice sites. Chief among them was the Great Northern Haven, or the Barrack Street complex, which is located in Dundalk, which is halfway between Dublin and Belfast on that Dublin to Belfast corridor, and looked to draw out the learnings from those. And as I say, in many of those cases, they're somewhat obvious, but they've proved to be very valuable in having those recommendations taken up within development plans locally and within our national housing strategy, which has been written currently. The base case is the Barrack Street project. It features 16 apartments and was brought about through this idea of collaboration. So local government working together with the health services and an academic partner, the local Institute of Technology in Dundalk. It features 16 apartments. Location is all important. This idea of a central location within promoting, facilitating walkable access, a big technology aspect. It's laden with sensors, so facilitating effectively the development or introduction of a living lab. And it's supported by this idea of service brokers. In Ireland, we are in the Dundalk programme, we call them the Cooltaka, but it speaks to the value of conferences like this. It is informed by, borrowed from, taking from good or best practice, a Dutch example, the Untitled Chapter, which I understand operates in Trinwalden in Northern Holland. So we look to that good practice example and look to customise it and apply it within an Irish context. It features promoting walkable access. So there's a number of Key services, so thinking about it, the pub, the chemist, the shop, the post office, the church, the primary care centre, also a swimming pool, all within 150-metre walkable distance for supporting those residents to age in place and to engage positively with their neighbourhood. Other features, in addition to the 16 units, this idea of an outreach centre to promote social engagement, to promote intergenerational exchange, to facilitate learning, particularly to facilitate learning around technology and the use of social media. Older people talked about many of their children, their grandchildren, having emigrated recently because of the financial crisis to places like Toronto, Vancouver, New York, and Sydney. So they talked about, I'd love to communicate with my children, my grandchildren. And so Skype classes became a really interesting introduction, and there was an intergenerational exchange about younger secondary school students teaching some of the older residents how to use these technologies. Not going into too much detail, but lifetime adaptability, so that the apartments are able to change over time to reflect the changing personal circumstances of the older adults. So even simple things like to facilitate that the ceiling is sufficiently strong to facilitate the introduction of a hoist, should it be required. And obviously technology has played a key role there. The cool talker or the umthinker role, it's a facilitative role supporting the cool talker to work with older people, supporting them older people to develop their own plan and to identify what changes they could usefully bring about. It's a linking, brokering role, providing the cool talker facilitating older people to access key services and effectively building resilience or capacity within that older adult population. 2 posts supporting not just the 16 residents, but 750 older adults across Dundalk and North County Louth. So the Cultaca would work intensively with the older adults and then would build up a Cultaca volunteer base to work on an ongoing basis with those older adults. On the technology side, nothing at all revolutionary. Many of the things we're probably carrying around on our own mobile phones, courtesy of web apps and the like. But most importantly, they were co-designed with the older adults. And older adults said, look, to us, we don't want a whole host of services. We just want services that are relevant and meaningful to us. And pieces that will facilitate prevention and early intervention. Just picking out one piece, this is a clock plot. So picking out each ring in a circle represents a 24-hour period in the day. So 2 different, very different experiences. The picture on the right, somebody who hasn't left the apartment, very disturbed sleep, and depression is about to onset. And conversely, on the left, somebody who's very active, very engaged, and engaging with the local community. So these simple things designed by the older adults effectively are informed by the older adults, facilitating empowerment and self-management. Things, just picking out a few key pieces in terms of the physical interventions, emphasis on location, because the policy piece 10, 20 and 30 years, over the previous 10, 20 and 30 years was to look outside the towns, villages and city neighbourhoods to the greenfield sites. So this has reinforced that absolute need to look at the brownfield sites and to build these types of services within walkable access of key services that can support independent living. In Ireland, and possibly it's common with other jurisdictions, siloed planning was very much embedded. The local authority, for example, would have had a waiting list for housing allocations. The health service would have had a waiting list for entry to long-stay care. So this facilitated the integration of those lists and the facility to prioritise those who might be at risk of premature entry to long-term care, all supported by that Cultaca or umtinker role. The research or the evaluation identified that technology is welcomed by older people, particularly when it's geared and designed around their particular interests and needs, where it facilitates or enhances safety and security, where it allows older people, the older residents, to monitor their own health, where it supports social connectedness, I think has been all important. In Ireland, we do not have a very strong and effective rollout of broadband. There'd be a lot of rural, remote communities would have very poor and very limited access to broadband. So these simple research recommendations, there's been a pickup at policy level that planning around older person accommodation, that broadband will be built in from the get-go and the design phase. A number of minimum requirements there spelt out across a much more extensive suite of possible interventions or introductions. That Umtinker or Kultaka role, it's really helped to build up a capacity or strength within the Irish system at that local level, supporting one working and the development of really considerable insight and expertise in working with older people, and has helped to address that previous fragmentation, that absence of coordination across the agencies. And the evaluation that's just been conducted, it's helped to enhance or heighten, bring about improved health and well-being outcomes, and in parallel reduce demand on the acute services. So some basic learnings. This type of housing, and there's been a commitment now both at the local level and the national level, this type of housing should not be really designed or introduced, or the turf should not be cut without some form of service brokerage being available to support effective independent living and sustain tenancies. That it should be close to key services, that it should have some technology component and these softer social supports to affect a positive quality of life and to facilitate a positive quality of life and engagement with one's neighbourhood. So, how am I doing on time? We're okay, a couple of minutes? Yeah, okay. So, it's just really one example, that housing solution, but it's very much built in that notion of collaboration. So the coming together of the agencies, working and committing to work with older people. So Alliance and Older People's Council working collaboratively. And the Age Friendly programme has allowed us to develop at this local level, like in Dundalk or County Louth or Dublin or Cork or Galway or wherever it might be. It's allowed us to develop an effective model for bringing diverse organisations, groups, services and businesses together to streamline their work with the interests and needs of older people at their core. So we would argue when policies, when programmes, when actions are reframed in this way, the whole of community benefits. So you'll be able to this is the what's next for us, but I might go back to those core messages about the need to think local, to listen to the voice, to share experience, because we've looked to your experience and looked to pick up your experience and to customise it and apply it to the local need in Ireland. So thank you, the Netherlands, for that key example, and that call to not just to be willing to partner with other organisations, but the absolute imperative to get good at it. And it comes with the caveat that we have not got it cracked, but it takes continual investment to build up trust and to develop those relationships, and to be looking at those kind of blurred line areas that go beyond any one single agency's core remit. So we're looking to scale up those structures, to bed them in, and to look at those pockets of practice. So in Dundalk, County Louth, housing was the big issue. In other areas, transport was the big issue. In the more rural, remote communities of Cavan, Monaghan and Meath, loneliness, isolation, fear of crime were big issues. In Kilkenny, they've done a lot of work around the public realm, the built environment. So picking up those local pockets of very practical practice and look to support their introduction right across the country where they would have an application following some local customisation. And then to join up that local practice with the national policy context. And like the previous speaker, to look to support the introduction of a stronger evidence base, so that this can be tracked over time and that we can measure impact over time, so that the programs like this get resourced effectively because they're demonstrating that they're working. And very finally is an invitation. Please come to Dublin. We would love to see you. We're hosting a conference at towards the middle end of October. Be an opportunity to hear from the European experience, further afield around positive and healthy ageing. We'd love to see you there. Thank you so much.
Thank you very much. Thank you for the invitation. Is there a question? Someone who wants to ask a question? If you have no one, I have one, at least, because I saw in your presentation you showed us this nice project for new housing, but there was one quote from all older people. If I could, I would like to stay in my own house, this house. Adapt it, please, if possible. Do you have any idea about how big this challenge in Ireland is for adaptation of existing houses for older people?
Yeah, well, look, very, very brief. It's a very significant challenge, but I think it's about, sorry to be cliched, it's about joining the dots up for some of our decision makers, our policy makers, and our budget holders, because it has certainly a relevance around community social participation, supporting successful independent living, but there's also an economic benefit to it, in that the previous policy was about kind of expanding out our towns, building in the greenfield, and as a result there's quite a number of hollowed out towns. So we're trying to draw those older people back into the town centres, so retrofitting houses would have real application, but would also have real economic benefit, through the stimulus that something like that could bring about. So it is possible, and there is a drive to retrofit houses to introduce some of these really basic kind of technologies and recommendations around the built environment to support independent, successful living.
Okay, thank you very much.
Okay.